Hello, everyone, and welcome to this presentation titled Addressing STI Disparities Among Black and Brown Adolescents in the Southern United States, a research review. We have a few different objectives for this presentation, so by the end of this presentation, you will be able to identify the key factors contributing to STI disparities among Black and Brown adolescents in the Southern United States. You will understand the impact of existing sex education policies and their role in shaping sexual health outcomes for adolescents. You will explore successful sex education models from other states and their implications for policy reform and program development. And my goal for you is that you will be able to develop strategies for implementing culturally competent and rights-based interventions to address STI disparities and promote health equity. And I will be your presenter for today. My name is Bria Pringle-Weston, and I am a recent Master of Public Health graduate from Georgia State University. I have been an adolescent sexual health intern at NCSD since January of 2024. My background is rooted in public health, with a particular passion for addressing health disparities. Today, I will be presenting my internship project titled Addressing Disparities in Adolescent STI Rates, a research review for Southern states. This review was conducted to shed light on the disproportionate impact of sexually transmitted infections on minority youth in the South, and to explore effective interventions and strategies to reduce these disparities. I just want to go ahead and say thank you for joining this session, and I look forward to sharing my findings and discussing this critical public health issue with you. Starting right off, we're going to look over a research overview. So this research aimed to dive into the disparities in sexually transmitted infections among adolescents in Southern states, and I chose to focus on a few different states, so Georgia, Florida, Texas, and North Carolina. The objectives of this review were to explore the factors contributing to STI prevalence rates among adolescents based on demographic factors such as race and ethnicity, as well as to synthesize the evidence to provide recommendations for future program development and resource allocation. You will hear me refer to my target audience in this review as Black and Brown, which is further defined as African American, Hispanic, and Latino youth. STIs pose significant public health challenges, particularly amongst this population. And a few of the different methods that I use in this research review were I analyzed CDC reports, state health department data, youth risk behavior survey reports, and literature reviews and peer review articles. The goal was to explore what is currently taking place in these Southern states in regards to sex education curriculum, prevalence of STIs amongst adolescents in those states, disparities in STI rates, policy implications, including successful comprehensive sex education policies, and recommendations. So let's hop right into it. Let's look at the STI prevalence in Southern states. The data provided here shows that these states have consistently higher rates of STIs, particularly chlamydia, when comparing Black and Brown youth and their white counterparts. So if we just take a brief look over these data and these numbers, we can see that most of these are looking at the teen population. So we have 15 to 17, 15 to 19, and 14 to 18. And what is really important to note is that in all of these states, you can see that the rate of chlamydia is 4 or more times higher among a Black and Brown youth than it is for white youth. And the data clearly indicates that Southern states are experiencing significant challenges in controlling STI rates among their adolescent populations. However, it is important to note that these numbers might not fully capture the situation. Adolescents, especially those of color, and those facing intersectional challenges may be underrepresented in these statistics due to various barriers in accessing healthcare and reporting. We will discuss these disparities and underlying reasons in more detail in the next section. Let's dive directly into the key factors contributing to the disparities in STI rates among adolescents in the Southern states. While this is not an exhaustive list, these factors were consistently identified across various states and research studies. First, barriers to healthcare play a significant role. Many adolescents face difficulties accessing healthcare services due to lack of nearby facilities, transportation issues, and a shortage of healthcare providers who are culturally competent and sensitive to the needs of a diverse population. Also, their socioeconomic status, which is another critical factor. Adolescents from low-income families are less likely to have access to quality healthcare and sexual education. Economic constraints can limit their ability to afford preventative measures and treatment, further exacerbating STI rates. There's also cultural influences, which contribute significantly. In many communities, particularly in the South, there are strong cultural norms and stigmas surrounding discussions about sexual health. These cultural barriers can prevent open communication about STIs and discourage individuals from seeking necessary care. And then lastly, intersectionality must be considered. Adolescents who belong to multiple marginalized groups, such as those who are Black, Hispanic, LGBTQ, or living in rural areas, face compounded barriers. These intersecting identities can intensify the challenges they encounter in accessing healthcare and receiving appropriate and timely interventions. It is important to remember that these factors are interconnected and create a complex landscape that influences health outcomes. By understanding and addressing these contributing factors, we can develop more effective and equitable public health strategies. And this review would definitely not be complete without mentioning the role that policy plays in STI disparities. So first, let's consider the current sex education curriculum in Southern states. Many states mandate sex education, but the content often emphasizes abstinence over comprehensive education. This approach tends to neglect critical topics such as consent, contraceptive use, and the diverse experiences and identities of adolescents. In states like Florida and Georgia, for example, sex education policies allow for the promotion of religious views and lack requirements for medical accuracy and cultural appropriateness. And we also have to just touch on funding. So next, the Biden-Harris administration's funding is particularly relevant. This administration has allocated funding to support broader public health infrastructure and workforce development. These funds are crucial for enhancing the capacity of public health systems to address STI prevention and treatment. However, it is imperative that this funding is directed towards evidence-based programs and interventions that are inclusive and culturally sensitive. Moving on, one significant policy implication that is an urgent need is comprehensive sex education reforms. Current policies must evolve to mandate inclusive and medically accurate sex education that equips adolescents with the knowledge and skills necessary to make informed decisions about their sexual health. This includes addressing topics like consent, sexual orientation, and gender identity to create an inclusive environment for all students. Furthermore, there is a strong need for advocacy for diversity, equity, and inclusion in sex education. Policies should ensure that sex education programs are culturally relevant and responsive to the unique needs of diverse adolescent populations. This advocacy is essential to dismantling the structural barriers that contribute to health disparities. And lastly, but definitely not least, structural reforms are necessary to address the broader social determinants of health that contribute to STI disparities. This involves tackling issues such as poverty, discrimination, and the limited access to healthcare. By implementing structural reforms, we can create an environment that supports the health and well-being of all adolescents, regardless of their background. Overall, addressing these policy implications requires a coordinated effort from policymakers, educators, public health professionals, as well as community organizations in order to promote health equity and improve sexual health outcomes for adolescents in the Southern United States. And moving on from these policy implications, let's look at how some states have tackled these issues. Let's look at some successful policies. So California's Healthy Youth Act, implemented in 2016, has been associated with positive outcomes, such as increased knowledge about sexual health, improved attitudes towards contraception and condom use, and reductions in teenage pregnancy rates and STI transmission. Similarly, Oregon's Healthy Teen Relationship Act, which emphasizes comprehensive sex education beyond abstinence-focused programs, has demonstrated positive impacts on sexual health outcomes among adolescents. By incorporating topics such as healthy relationships, sexual violence in relationships, consent, and LGBTQ plus inclusivity into sex education curricula, Oregon has seen reductions in STI rates and improvements in overall sexual health outcomes among its adolescent population. It is crucial to note the successes that are taking place because we can learn from these states through various ways, but particularly through collaboration and state pairing. And now let's get to these recommendations. So it is essential to adopt a comprehensive approach that integrates evidence-based interventions. This means utilizing proven strategies and interventions to effectively address STI prevention among adolescents. By relying on data-driven methods, we can ensure that our efforts are both effective and efficient. Utilizing frameworks like the Humanitarian Accountability Partnership, HAP for short, is crucial. This framework ensures that sexual and reproductive health programs are implemented in a rights-based and culturally competent manner. This means that adolescents' needs and rights are at the forefront of program design and implementation, leading to more effective and ethical interventions. We also need to prioritize capacity building for healthcare providers by developing online training modules. These modules should be tailored to the needs of frontline healthcare providers, enhancing their ability to deliver comprehensive sexual health services. By equipping providers with the necessary skills and knowledge, we can improve the overall quality of care and the support available for adolescents. Also, advocating for policy reforms similar to the California Healthy Youth Act is another key recommendation. This act mandates comprehensive and inclusive sexual health education in schools, ensuring that all students receive accurate and relevant information. By pushing for similar policies in other states, particularly in the South, we can promote more effective and inclusive sex education. Also, collaboration. Collaboration is key, and collaboration with community-based organizations is vital for developing culturally relevant educational materials and outreach campaigns. These organizations have a deep understanding of the communities that they serve and can help ensure that interventions are culturally sensitive and effective. Also, overcoming barriers such as limited funding and resistance to comprehensive sex education. This is something that requires innovative solutions. Exploring alternative financing mechanisms such as public-private partnerships and grant funding can help sustain STI prevention programs. Additionally, public education campaigns are necessary to dispel myths and misconceptions about comprehensive sex ed, as well as to build a broader support. Expanding access to healthcare through telehealth services and mobile clinics is also very crucial, especially in rural and underserved areas. These solutions can bridge the gap in healthcare access and ensure that adolescents receive the necessary sexual health resources regardless of their location. And lastly, addressing cultural and linguistic barriers through targeted training programs and outreach is essential. So healthcare providers need to be equipped to communicate effectively with diverse populations, and outreach efforts should be designed to resonate with different cultural and linguistic groups. By doing so, we can ensure that all adolescents have access to the information and services that they need. In summary, while there are significant barriers to implementing these recommendations, a comprehensive and collaborative approach that integrates evidence-based interventions, utilizes frameworks like the Humanitarian Accountability Partnership, and prioritizes capacity building and policy reforms can make a substantial impact on reducing STI disparities among adolescents. To close, let's recap the key findings of this research. Persistent disparities in STI rates among Black and Brown adolescents in the Southern United States remains a significant public health challenge. These disparities are driven by a combination of socioeconomic factors, structural barriers, and inequalities in healthcare access. Despite efforts to address these issues, the rates of STIs among these populations continue to be disproportionately high. Addressing these disparities requires targeted funding and resource allocation. Adequate funding is essential to develop and sustain effective public health interventions. This includes investing in comprehensive sex education programs that are inclusive and culturally sensitive, as well as expanding access to healthcare services. Funding should also support community-based initiatives that directly engage and educate adolescents about sexual health. Furthermore, leveraging public-private partnerships can enhance the reach and impact of these interventions. One of the major barriers that we face is societal resistance and ideological differences regarding comprehensive sex education. Many communities and policymakers continue to favor abstinence-only education, which does not provide adolescents with the full spectrum of information that they need to make informed decisions about their sexual health, about their overall health. Additionally, there are cultural and religious beliefs that can hinder the acceptance and implementation of comprehensive sex education. Overcoming these barriers requires persistent advocacy, public education campaigns, and collaboration with community leaders to shift perspectives and build support for more inclusive and effective education policies. Looking ahead, there are several critical areas for future research and policy change. Further research is needed to explore the specific needs and experiences of Black and Brown adolescents, ensuring that interventions are tailored to address their unique challenges. Policy change is also crucial. This includes advocating for reforms that mandate comprehensive and inclusive sex education across all states, particularly in the South. Additionally, efforts should focus on addressing the broader social determinants of health, such as poverty and discrimination, that contribute to STI disparities. By continuing to push for evidence-based policies and inclusive practices, we can make significant strides towards achieving health equity for all adolescents. In conclusion, while these challenges are significant, the path forward is clear. With targeted funding, which can help overcome a lot of our societal barriers, and committing to future research and policy advocacy, we can address the disparities in STI rates among Black and Brown adolescents and move toward a future where all young people have the knowledge and resources that they need to lead healthy lives. Thank you so much for your time. I hope that you are able to leave this presentation feeling positive about the role that you have in closing these gaps and decreasing these disparities. You will be able to read the full research review on the NCSD website under Adolescent Health, as well as access additional resources to guide your work with adolescents. If you would like to connect with NCSD's adolescent team, you can send an email to adolescenthealth@ncsddc.org. And that's all that I have for you all today. Thank you so much for listening, and take care.